July is Minority Mental Health Awareness Month. It is a time to spotlight the unique mental health challenges faced by underrepresented communities.
Joining us today is Dr. Monir Al-Nabolsi, a family medicine physician at Corewell Health, to help deepen our understanding of this topic. Thank you for being here with us this afternoon.
Thank you so much for having me today.
Yeah, so first, just talk about the significance of Minority Mental Health Awareness Month.
Yeah, but this month it really shines a spotlight on the various disparities that we see, particularly in racial and ethnic minority communities. Now, this is a problem in all communities, to be fair, but this month particularly, we see it much more common in the minority communities, and the point is to really raise awareness about the stigma, about the various barriers that people may have, and particularly cultural disconnects that may prevent people from seeking care in the first place.
Yeah, and that's kind of the jumping off point, if you will, is identifying some of the most common barriers for minority communities to actually get the mental health services they need. Highlight a few of those so we understand why it is more difficult.
Yeah, absolutely. The stigma is really the biggest thing. You know, we've all heard of the stigma of mental health, but particularly in minority communities, it's to a different level. I mean, for example, I come from a Middle Eastern community, and this is something that it's getting a lot better now. But when I was growing up, this is something that nobody talks about. It's really frowned upon to discuss it. And so it's really the stigma is the biggest thing. And when you're raised in a way that you never feel comfortable talking about this kind of stuff, you're not going to be very easily comfortable as an adult talking about this stuff. But there's some other barriers as well. Cultural misunderstandings are a big thing. So it's important to try to kind of have a good match between the healthcare professional and the person. Lack of access is a big deal, and I think that might be in the next couple of years. We'll see what's going to happen, but a big problem in the next couple of years. But access is a big thing. Financial constraints, underrepresentation in the field, even things like access to internet or broadband access, things like that. But those are the big ones.
How can primary care physicians help address mental health? How do you address it?
It's a great question. You know, PCPs are the first line of defense for this type of thing. So all of our expert organizations or the people that we try to listen to for guidelines tell us to screen every single time, regardless if you're coming for whatever type of visit. So screening is very important. And a lot of people, you don't necessarily have to start out with a mental health professional. PCPs are really, at Corewell especially, they really focus on this. They make sure that we're hitting these screenings, that this is some type of discussion that we're having on a regular basis. If we need referrals, if we need therapy, if we need resources, we are able to help point people in the right direction. But the biggest thing is really normalizing the discussion. You know, people feel very scared to talk about this kind of stuff, but you don't feel scared to talk about blood pressure, or not as much. But really normalizing the conversation is a big part of it as well.
And it all begins with that primary care doc. And we've talked about this with you and with your colleagues repeatedly as we do these interviews, that it's so important to have that primary care doctor in place. But if you don't have one, that's kind of where you need to start. How do you access that if you don't have one already?
Yeah, absolutely. I mean, primary care docs are one of the professions that has a lot of need, a lot of people that we need to go into primary care. But in order to find somebody, there's various ways that you can do that. You can ask your insurance, you can go online, you can go to each different system, like as a directory where you could kind of look up doctors, but you want to start with someone that you trust, and primary care is a good way to do that. Nowadays, there's a lot of reviews online, there's a lot of background that's published. Like I get some patients that just read my background online and they come see me, and that's a very common way to do that now. So I would encourage people to go online, look at what other people are saying, see if that's somebody that you might connect with, and go ahead and make that step. The first step is asking for help and presenting and making that move to go see the primary care physician. And often it's considered a sign of weakness, but that's one of the hardest things to do, and it takes a lot of courage to do that.
Dr. Monir with Corewell Health, thank you for being here with us this afternoon. We appreciate you.